Hoy en este canal estaremos contando y relatando una de las historias más perturbadoras y aterradoras relacionadas con la odontología. El caso de David Acer, el dentista que transmitió VIH a sus pacientes. A finales de los años 80, cuando esta patología prácticamente era una sentencia de muerte y se conocía muy poco sobre su transmisión, ocurrió uno de los casos más inquietantes en la historia de la odontología. David Acer era un dentista canadiense que ejercía en el estado de Florida, en Estados Unidos. En 1987 fue diagnosticado de VIH y a pesar de su diagnóstico continuó ejerciendo su profesión y atendiendo a sus pacientes. En 1990, el Center Disease Control and Prevention, CDC o CDC, confirmó algo que en esa época estremeció al mundo entero. Al menos 6 pacientes se habían transmitido de esta patología tras haber recibido tratamiento dental en su consulta. Este, hasta el momento, es considerado el primer caso documentado de transmisión de VIH desde un profesional hacia sus pacientes. Y ustedes se preguntarán, ¿qué ocurrió? ¿En qué medida el profesional se estuvo saltando o estuvo evitando o no tuvo en cuenta? Bueno, hasta hoy, por toda la información que hay en las redes, la información que hay en el historial de este profesional, nunca se pudo demostrar con total certeza. No se encontraron pruebas claras que afirmaran que David violara alguno de los protocolos de esterilización. Pero sí tenemos un dato importante en todo este caso y toda esta historia, y es que los análisis genéticos del virus mostraron que las cepas eran extremadamente similares. Eso científicamente puede probar una cosa bien clara: la infección provenía del mismo origen. Este acontecimiento para aquella época, en cuanto al estigma que existía, la discriminación porque un paciente estuviese contagiado de esta enfermedad, cosa que, abro paréntesis, muchos años después, en la actualidad sigue existiendo, la posibilidad de que un dentista o que un profesional con esta patología pudiese transmitírselo o contagiar a sus pacientes, provocó en aquella época un pánico nacional. Se podrán imaginar que miles de personas dejaron de acudir al dentista. Las llamadas en las clínicas estaban completamente colapsadas y la confianza hacia los protocolos sanitarios se desplomó por completo. Por si fuera poco, para ese entonces no existían los tratamientos antirretrovirales modernos. El estigma, como les mencioné anteriormente, hacia el VIH era brutal, más brutal que como son en los tiempos recientes, y había un balance entre la información que era limitada y el miedo que era enorme. Este caso en particular provocó un cambio radical en la odontología mundial. A partir de entonces se reforzaron estrictamente las precauciones universales. Comenzó el uso obligatorio de los guantes, sea cual sea el paciente que usted esté atendiendo, en las condiciones en las cuales llegue y las patologías que puede presentar. Algo que sí forma parte del protocolo universal, general, mundial a día de hoy al tratar con estos pacientes es la recomendación de una protección doble, o sea, si de por sí para atender a cualquier paciente necesitamos el uso de guantes, también es necesario para estos pacientes el uso de una barrera de protección doble, de guantes dobles, una esterilización rigurosa que con estos pacientes es un poco más especial que otra persona que no presenta esta patología. Protocolos más severos y control epidemiológico. Pudiésemos alegar que lo que ves hoy normal en una clínica dental, ya sean los guantes, las gafas, fue impulsado por parte de este caso. Veamos el desenlace de este caso o de esta historia tan triste y lamentable. Si nos situamos al protagonista de ella, que es David Acer, este estuvo falleciendo precisamente en el año 1990 debido a complicaciones con esta patología, que como les mencioné anteriormente, para aquella época no existían todos estos tratamientos modernos, todos estos antirretrovirales que de cierta forma disminuyen la carga del virus y llega a un punto en el cual no transmite la patología. Nunca logró confesar o nunca confesó haber transmitido el virus intencionalmente. Sin dudas, este sigue siendo uno de los casos más controversiales dentro de la historia médica.
It happened to Kimberly Bergalis, and suddenly almost everyone felt at risk. Last summer, federal authorities documented that the 22-year-old Florida resident was the first person in the United States to contract AIDS during dental treatment. The Centers for Disease Control kept her identity secret, but she chose a public stand.
If this can be prevented from happening to another family, then that needs to be done.
Bergalis, who said she had no other risk factors for AIDS, had had 2 teeth extracted in 1987. Health officials at first dismissed her claim that her dentist, Dr. David Acer, then rumored to be dying of AIDS, may have infected her. But a new laboratory technique called DNA sequencing showed that the strains of virus infecting both doctor and patient were almost identical, meaning the 2 cases were somehow linked. Then in January, the CDC reported 2 more cases of HIV infection linked to Dr. Acer. Barbara Webb was treated for a toothache on the same day Kimberly Bergalis had molars pulled. And Richard Driscoll, who on one visit in 1989 had his teeth cleaned the same day as Barbara Webb. Webb says the dentist diagnosed in 1987 never told his patients he had AIDS.
If I were forced to talk to him, I think I would ask him why he did something so terrible to 3 people and potentially more. How he could find it in his conscience to treat people when he had AIDS and he knew it.
No one knows exactly how Acer's patients became infected. 2 days before his death, the dentist published an emotional statement claiming he had, quote, strictly adhered to the CDC's infection control guidelines. And as for telling his patients, well, for years the CDC has maintained that the risk to patients from HIV-infected healthcare workers is so small, actually hundreds of times smaller than the risk to healthcare workers from infected patients, that disclosure is unnecessary. But with the emergence of the Florida cases and mounting public fear bordering on panic, the agency felt new pressure to change its stance.
Kimberly Bergalis' dentist had AIDS. He knew he had it, but he refused to notify his patients that he had AIDS. And now, as Paul Harvey says, you know the rest of the story insofar as Kimberly. She doesn't have a chance. So I don't think a 10-year sentence is severe when you compare what these people are willing to do to their innocent patients. So don't talk to me about 10 years being too severe. I'm so old-fashioned that I believe in horsewhipping. I feel that strongly about it. And you consider whether your wife or husband or children or grandchildren could be subject to this sort of thing that Kimberly Bergalis has suffered. But Kimberly Bergalis is not alone. There's so many episodes popping up. Over in Minnesota, there was a pediatric surgeon who continued to deliver babies, and he did rectal and vaginal examinations months after he knew that he had AIDS. And what does one say to the mothers in Minnesota? One of them who told Newsweek magazine that every time she sees her infant with a diaper rash, she worries whether her child is infected with the AIDS virus. Vote as you please, Senators, and make whatever comment you want to. But I tell you, the American people understand this issue. And if this amendment goes down, a lot of questions are going to be asked when senators get home. How come you voted against it?
So what we have today, Mr. President, is the proposal of the senator from North Carolina. And maybe there are going to be those here in this body that say, oh, we're going to vote for that. And they'll be able to go back home and say, we really ensure that the health delivery system today is going to, you're really safe, you're really secure, you're free from the possibilities of contacting HIV or AIDS because we voted for the Jesse Helms Amendment. To put anyone that knowingly is going to have, under his definition, invasive procedure, they're going to go to jail. Therefore, go on into your hospital, your medical center, your dentist's office. There really is no chance that you're going to ever get HIV. Well, that is nonsense. That's nonsense. What medical profession, if they feel that they may be at risk, is going to take the test and then they know that that is going to end their career in practicing medicine? Because then if they knowingly have HIV and then go out and provide or go forward with some invasive procedure, then they go to jail. So if that individual thinks they may or may not have it, what are they going to do? Are they going to go out and get the test? Of course not. Of course not. And they're going to continue to practice medicine and put the patients at greater risk. That's going to be the effect of the amendment from the senator from North Carolina.
As expected, the Helms Amendment carried. The vote was 81 to 18. The 18 were from both parties, most liberal. The Senate leadership, however, wanted to take the sting out of the Helms Amendment with a compromise. The states would have 1 year to set up guidelines similar to those issued on Monday by the Centers for Disease Control. Republican Orrin Hatch of Utah, who favored Helms, also favored the compromise.
Specifically, these guidelines encourage healthcare workers to adopt certain universal precautions to protect patients and workers from the possible spread of the HIV virus. In addition, these guidelines require healthcare workers who test positive for HIV to either refrain from performing exposure-prone procedures or notify prospective patients before performing such procedures. Over 90% of our citizens support mandatory disclosure by nurses, physicians, and dentists who are infected with HIV. I believe, as CDC does, that the disclosure must occur when procedures are performed which put the patient at risk of exposure. So I join Senators Dole, Mitchell, Kennedy in supporting an amendment to enforce these guidelines.
As the CDC grappled with that issue, stories of doctors and dentists with AIDS made headlines. The state of Delaware offered free AIDS tests to patients of a dentist who had died 2 weeks earlier. An Ohio hospital dusted off the patient files of a surgeon whose death from AIDS was reported in 1988. And back in Florida, an orthodontist with AIDS closed up shop and advised his patients to be tested. But nowhere was the public outcry louder than in Baltimore, Maryland, where residents awoke one Sunday morning to this banner headline. The doctor was Rudolph Almarez, a prominent surgeon specializing in breast cancer, who counted movie stars and the wives of presidents among his patients. Although some of those patients now say they suspected he had AIDS, they feel betrayed that he didn't tell them.
It's a terrible tragedy that Rudolph Almarez had AIDS, and it's a terrible tragedy that he died. But I don't think it's right that he continued to do invasive procedures without the informed consent of his patients, or at least me anyway.
I mean, even though they say the chances are very slim that he nicked himself and that blood fell into my chest cavity, I don't know that. And I might be just that one person that happened to.
Johns Hopkins Hospital, where Almarez operated, sent letters to his patients offering free testing and counseling. Almost immediately, Baltimore lawyers sprang into action.
The right of privacy does not extend to murder.
Jonathan Shukor specializes in personal injury and medical malpractice litigation. He's filed 2 suits for more than $30 million each against Hopkins and the Almarez estate, and has up to 30 more cases in the works. Are any of your clients currently HIV positive, and are you advising them to take any particular medical steps?
At this point, I know of no HIV client. That does not mean that we won't know of one tomorrow or the next day. We simply do not know. It is early on in the process. At the least, these people are going through serial blood tests where they're being tested for AIDS.
Would you still have a case if none of your clients ever became HIV positive?
Absolutely. The fear of this disease, the anxiety that they go through, the sleepless nights, the need for serial testing called surveillance damages, they have to keep going back for these tests. I don't think any of us want to walk around every day wondering whether we have the disease or not.
95% of all people who become infected with the AIDS virus show a positive test result within 6 months of exposure. 5% can take up to 2 years to become HIV positive. Although Suzanne Rittmiller was operated on by Rudolph Alvarez 2.5 years ago and has tested negative twice, she still feels at risk.
I am in panic. It happened to me, and something should be done about it.
Rittmiller has consulted a lawyer. Terry Warren has not. She is HIV negative 2 years after her mastectomy.
I don't feel that any harm was done me, and I feel lucky to have had Dr. Alvarez as a surgeon when I did. I don't think I have any grounds for a lawsuit. I have problems with the fact that lawsuits are being filed by people who, as far as we know, did not contract AIDS.
You may actually have felt differently about Rudolph Alvarez if he had operated on you when he had open sores on his face and hands. He did when he operated on me.
Linda Schoeffel was operated on by Dr. Alvarez in February 1990, the month before he became too ill to work. She and Suzanne Rittmiller both believe HIV-positive healthcare workers should be barred from performing invasive procedures.
Why even take the chance? Why even take that risk? Even though Dr. Alvarez is one of the best, no one is indispensable, and you can find probably just as good surgeon anywhere else.
He was so talented at what he did, and very brilliant, that he could certainly have been a consultant or taught and been very successful anyway, without doing the actual surgery.
It's pure fiction to imagine that a surgeon who was performing abdominal surgery, let's say, all of a sudden will be hired by a hospital just to do teaching.
Dr. Hasib Aoun speaks from experience. In 1983, as a cardiologist at Johns Hopkins Hospital, he contracted AIDS from a patient. His highly promising career was finished.
Even looking for academic jobs, teaching house staff, and not involved into doing any invasive procedures at all. Your credentials all of a sudden are not the important matter. What is important is that you're HIV infected. And then the doors close in a way that they would not have closed before, so you not have been infected.
Dr. Aoun now writes and lectures and has become a leading advocate for the rights of HIV-infected healthcare workers. He believes they can continue to practice and even perform all but a few invasive procedures safely. In recent testimony at the CDC, he urged the agency not to base its policy solely on the Florida cases.
And there are many more risks to patients at hospitals, much more significant than AIDS. I'll give you an example. Cardiac catheterization. Well, cardiac catheterization is an important diagnostic procedure. Some patients die from it, but we don't just cancel out the procedure because it's useful. Well, similarly, all these HIV-infected professionals, they're still very useful for society and for themselves, for their own families. And removing them from the practice of medicine, from patient contact, is almost criminal. And it establishes a vicious cycle that will never stop. You feed into the fears of the public instead of educating the public by issuing restrictive guidelines that are not based on science.
Apart from the patients in Florida, the science so far, based on 3 published studies, shows no cases of a doctor transmitting AIDS to patients. But many say that's not enough proof to conclude that the risk is minute.
We simply don't know who the other physicians and surgeons are, so how do we look at who their patients are? How do we know how many AIDS-infected, HIV-positive patients there are in this country who contracted the disease in an operating room or a procedure room?
Shukor and many others say healthcare providers who perform invasive procedures should be tested regularly and required to inform their patients if they become infected with AIDS.
There ought to be no physician that subjects you or any listener to the threat of AIDS without disclosing that threat before any invasive procedure is done. Because there's no reason for any of us to get this disease because a physician or surgeon doesn't feel it necessary to tell us about it.
I certainly think we all should have known. Unfortunately, I think that Rudy Alvarez understood that he would not be allowed to continue practicing at Hopkins, that he would not have any patients. He was not in a position to say, I'm a surgeon, would you like to have me perform surgery knowing that I have AIDS? That would never have been a choice. I think we need to provide healthcare professionals with some sort of real alternatives that they can be doing some sort of valuable work and provide them with some confidentiality before we say, you must disclose this information. I would like to have known, but not at that cost.
Así culminamos con este caso tan perturbador, tan polémico, tan lamentable relacionado con la odontología que quise compartirles en el día de hoy, del cual quiero que comenten en la parte de los comentarios qué les pareció, qué creen al respecto y si conocen algún caso similar relacionado con esta historia que nos gustaría también compartir en el canal para dialogar un poco sobre todos esos casos relacionados con la odontología. Coméntenlo en la parte de los comentarios porque se vienen unos cuantos contenidos relacionados con estos, contando y relatando historias y casos relevantes dentro de nuestra rama que se ha vivido históricamente o a lo largo de toda nuestra historia. De esta manera me estoy despidiendo. Hasta entonces, cuídense mucho y no olviden cepillarse las 4 veces del día. Hasta pronto.